Do you need surgery for a broken back? This is Dr. John Shim, and I'd like to say most of the time, no. When the doctors tell you that the X-ray show a broken backbone, it sounds very scary. It is very painful. You do not want to move. You do not want to cough. You are scared to sneeze. But when do you need to consider surgery? As in all things, it depends on the specifics of the situation. If you are watching this video, I hope that means you're either recovering from a broken back or you're hurting, but still can walk around, go to the bathroom, and take care of your daily needs. If you have normal nerve functions, you do not need to make the surgical decision on an emergency basis. As a general guideline, broken backs that need to have surgical management are associated with significant spinal cord or nerve root impairments that are associated with inability to move certain muscles because of partial or total paralysis or inability to control your bladder or your bowels. Without getting too graphic, it means you cannot move the muscles because you cannot move the muscles. It's not because of the pain. It means you cannot feel yourself soiling yourself or you cannot feel your bladder filling. Thank goodness that is a rare situation. For folks who broke their backs without nerve impairments, you may not need surgery. As a practicing spine specialist near the parachuting capital of the United States, Zephyr Hills, I've unfortunately seen catastrophic parachuting injuries. But the data on broken backs associated with military paratroopers support non-operative care of the so-called compression fractures of the back. Some of the studies have identified up to 20% of paratroopers having a break in that back, called a compression fracture, that healed without surgery and did not interfere with their ability to continue their military career. Injured worker information likewise show the vast majority of workers who developed compression fractures during work returned to work activities with minimal impairments and without surgery. In the 2015 Journal of Bone and Joint Surgery, Wood et al. Presented data on 16 to 22 years follow-up on people who did and did not have surgery for a more complicated, severe type of bony fracture of the back called a burst fracture. These folks did not have any nerve issues, but at the time of the original study, which is more than 20 years ago, it wasn't clear if surgery for these folks would be better or worse. So these folks were separated into two equal groups. One group had surgery, the other group did not. At an average follow-up of 18 years, the non-operated group actually had less pain and better function. Based on this information, surgeons are more cautious in recommending surgery for those who do not have any severe nerve impairments. I know every situation is different. Every patient is an individual. But this information should be considered by your surgeon before offering surgery for a broken back without nerve deficits. I'm Dr. John Shim discussing surgery for broken back bones. I hope this information was helpful.